Welcome back to Dr. Pooja's Gynepedia. And this is my 14th video. In my last video, we have discussed about fetal skull. Today, we will discuss about maternal pelvis, like how to hold the pelvis, then boundaries of pelvis and difference between true and false pelvis, their diameters and how to do the pelvimetry, and then last will be different type of pelvis. So, let's start our topic. See, on the right side of the picture, as you can see, maternal pelvis is formed by 4 bones. 2 hip bones, also called as innominate bones, 1 sacrum and 1 coccyx. Hip bone consists of ilium, then pubis and ischium. Then, how to hold the pelvis in the anatomical position in such a way that anterior superior iliac spine and pubic symphysis lie in the same coronal plane and inlet should make an angle of 55 degree with the horizontal. See, in this picture, examiner is holding the left ischium with the left hand with index and middle finger in the obturator foramen and thumb is placed medially. Okay, what are the boundaries of pelvic inlet? It starts from the upper border of pubic symphysis, then pubic crest and then pubic tubercle. Then fourth is upper border of pubic rami, iliopubic eminence, then iliopectineal line, also called as ilia terminalis, then sacroiliac joint, ala of sacrum and sacral promontory. These 9 points form the boundary of the pelvic inlet. Then what is false pelvis? It lies above the pelvic inlet. It doesn't have any obstetric significance. Just it supports the gravid uterus only. Then true pelvis lies below the pelvic inlet. It is anteriorly bounded by pubic symphysis, lateral by ischial bone and posteriorly by sacrum and coccyx. Then what are the different parts of the true pelvis? It consists of 3 parts. First is inlet, that is round in shape. Second is cavity, circular in shape, and third is outlet. It consists of 4 planes. First is pelvic inlet, then planes of great pelvic dimension and planes of least pelvic dimension, and fourth is plane of pelvic outlet, and outlet is divided into obstetrical and anatomical outlet. This is a chart of the different diameters that you have to remember. Please try to click a picture. Okay, I hope you have clicked a picture. Moving forward, we will discuss them separately. First, we will discuss the diameter of the pelvic inlet. First, anterior posterior diameters. These are 3 in number. One is anatomical or true conjugate. It extends from sacral promontory to the upper border of pubic symphysis and measuring 11 cm. Second is obstetric conjugate. It is the shortest AP diameter through which fetus pass during delivery. It extends from sacral promontory to the prominent point on the posterior surface of pubic symphysis and it measures about 10 cm. Third is diagonal conjugate and it is the only AP diameter which can be measured. It extends from the sacral promontory to the inferior margin of pubic symphysis. It measures about 12 cm. But how we used to calculate this diagonal conjugate? See, in this picture, we have to introduce the index and middle finger of the right hand in the vagina and try to palpate the sacral promontory. Then, we have to mark a point below the pubic symphysis till the tip of the middle finger and calculate the diagonal conjugate. Okay. Then, what is the transverse diameter of the inlet? It is the farthest point. It lies between the farthest point on the iliopectineal lines, measuring about 13 cm. Then oblique diameter extends from one sacroiliac joint to the opposite iliopubic eminence, measuring about 12 cm. Sacrocortiloid joint extends from sacral promontory to the same side of iliopubic eminence, measuring about 12 cm. Posterior sagittal diameter extends from sacral promontory to the point of intersection of obstetric conjugate and transverse diameter of the inlet, measuring about 5 centimeter. Let's discuss about the cavity. First, plane of great pelvic dimension, which is circular in shape. It is bounded anteriorly by the midpoint of pubic symphysis, laterally by the middle of the acetabulum of ischial bones, posteriorly by the junction of S2 and S3 vertebra. As it is circular in shape, therefore AP, transverse and oblique diameter of great pelvic dimension are 12 centimeter. Then what is plane of least pelvic dimension? It is anteriorly bounded by lower border of pubic symphysis, laterally by the tip of the ischial spine and posteriorly by the tip of the S5 vertebrae. AP diameter of plane of least pelvic dimension measures about 11.5 centimeter and lateral transverse diameter or bispinous diameter measures about 10.5 centimeter. Then what is a mid-pelvic plane? It is same as the plane of least pelvic dimension, except posteriorly it is bounded by S4-S5 junction instead of tip of S5. And therefore the space between plane of least pelvic dimension and mid-pelvic plane is called as mid-pelvis. Then what is the importance of plane of least pelvic dimension? It is the narrowest pelvic strait. It is the plane where levator ani originate and external os lies. It is the plane where internal rotation begins and completion of flexion of the fetal head takes place. It is the level where the forward curvature of pelvic axis starts. It is the level where the station of fetal head is assessed. It is considered to be zero at the level of ischial spine. It is the level where engagement is considered and deep transverse arrest occurs. It is the level where the pudendal block is given because pudendal nerve passes behind and below the ischial spine. Okay, outlet is divided into two, obstetrical outlet and anatomical outlet. Obstetrical outlet bounded above by plane of least pelvic dimension and below it is anatomical outlet. It is anteriorly deficient, laterally bounded by ischial bones and posteriorly by coccyx. Anatomical outlet is anteriorly bounded by lower border of pubic symphysis, lateral by ischial tuberosity and posterior by tip of coccyx. Then AP diameter of anatomical outlet is 10.5 centimeter. It increases to 13 centimeter in labor because fetal head pushes the coccyx by 2.5 centimeter. Then transverse diameter, that is intertuberous or transverse diameter of outlet, measures about 11 centimeter. There are two types of pelvic axis. One is anatomical, also called as curve of Caras. It is formed by joining the inlet, cavity and outlet. Second one is the obstetric axis. It is the path along which presenting part passes through pelvis. First it is downward and backward, followed by forward and downward direction. The change of curvature, as we have discussed earlier, occur at the level of ischial spine. Then there are 10 steps of pelvimetry. First, we have to ask the patient to evacuate her bladder, and taking her consent, patient will lie in supine position with knees and thighs flexed. Then, after separating the labia of the patient with the left hand, index and middle finger of the right hand under all aseptic condition is inserted. First, we have to assess the sacral curvature, tip of S5 vertebra for any projection, and coccyx mobility is assessed. Second, we attempt to palpate the sacral promontory. Normally it is not palpable, but if it is palpable, means pelvis have small anterior posterior diameter. Third, we will calculate about diagonal conjugate. As we have discussed it earlier, We will subtract 1.25 or 2 centimeter to get obstetric conjugate. Fourth, we will assess the lateral pelvic walls. They can be parallel, divergent or convergent. Then measuring the bispinous diameter by the index and middle finger, normally is more than 10 centimeter. Then we will palpate the sacrosciatic notch, and it normally accommodates 2 fingers. Then assessment of pelvis is done. Normally it also accommodates 2 fingers behind the pubic symphysis. Then assessment of pubic arch is done. As you can see in the picture, 3 fingers can be placed side by side. Then we have to measure the subpubic angle with the thumb and index finger of left hand. Normal it is 90 to 100 degree, as I have taken the reference from Williams. Then last is we have to measure the transverse diameter of the outlet by clenching the fist, and usually clenched fist is wider than 8 centimeter. Then how to assess the cephalopelvic disproportion? It can be done by abdominopelvic method, which is also called as Muller-Munro curve method. Left hand is placed at the suprapubic region and head is pushed inside the pelvic cavity, and it is seen whether the head can be pushed inside or not. Let's discuss the observation. If head is pushed till the level of ischial spine, means pelvis is normal. If head is pushed down but overlapping of parietal bones is there, means borderline pelvis. And if head can't be pushed and overlapping of parietal bone is there, displacing the thumb and pubic symphysis, is called as severe cephalopelvic disproportion. Then we will discuss about different type of pelvis. I'll be discussing about gynecoid and android pelvis. Gynecoid is 50% in normal it is present in female. Inlet is of round shape, means transverse diameter is slightly more than AP diameter, and in cavity side walls are parallel or slight divergent. Ischial spines are not prominent. Sacrosciatic notch is well rounded. Sacrum is well curved. And in outlet, pubic arch is wide and subpubic angle is 90 degree. And transverse diameter of outlet is wide, that is 11 centimeter. Then android pelvis, that is male like pelvis. In inlet, it is of triangular shape. In cavity, side walls are convergent. Ischial spine is prominent. Sacrosciatic notch is narrow and deep. Sacrum is flat and rotated forward. In outlet, pubic arch is very narrow and subpubic angle is less than 90 degree, and transverse diameter of outlet is small. It is totally opposite of gynecoid pelvis. So, this was my lecture on maternal pelvis. Hope you like my lecture, and if you like this video, please do subscribe my channel and do give me the feedback that how can I improve my lectures further. Thank you.